Hello, everyone that's joining. So I'm going to go ahead and introduce today's speakers. We have Teresa, who's a board-certified behavior analyst, and Caitlin, who's a speech-language pathologist. Both of these lovely ladies work to promote and implement behavior and communication goals for a child with Sanfilippo type B, who is just recently 12 years old. So I will let you guys take it away, and as you're introducing yourself, I'm going to put up our slides for today. So go ahead.
Okay, so my name is Caitlin. I'm a speech language pathologist, like she said. I've been working in the field for almost 2 years now. I started out as an SLPA actually while I was in graduate school, which stands for Speech Language Pathologist Assistant. And then when I finished my graduate program, I transitioned into the role of SLP, and I've been working since then. I received my master's of arts and communicative disorders from California State University Fullerton, where I also received my bachelor's. So I am definitely an alumni of Cal State Fullerton. And yeah, that's basically it. I like working with early intervention, AAC users, autism spectrum disorder, and that's a majority of my caseload is language-based intervention for either the 0 to 5, or a few of my clients, like our client we're going to talk about now, is a little older, and they're also autism spectrum disorder on my caseload. So that is me. Go ahead.
I am Teresa. I am a board certified behavior analyst. I started in the field at around 2012, and I was what's called a registered behavior technician, so just working directly with the clients. And I've worked with a wide range of autism, Down syndrome, cerebral palsy. I did early intervention for a while. The current agency that I'm at, Behavior Highway, I started. And we've been in business for about 3 years. We service all ages. Definitely have a soft spot for the AAC users. It's always a learning process. There's always new things that we can grow and learn about with that piece. And then just kind of figuring out how each learner is figuring out that device and using it to communicate and seeing some of those new connections has always been kind of a passion of mine. So you'll get to hear about the kiddo that Kaylin and I share, and it's kind of great to see her growth and her progress and what we've been able to do using the AAC with her. So if we want to go to the next slide, Cassidy. Oh, there we go. Perfect.
Okay, so we're going to just start off by kind of describing what I do as a speech language pathologist versus what Teresa does as an ABA, BCBA provider. So speech therapy, the goal of speech therapy, these are some of the things that we do. I assess and speech and language difficulties. I will develop and then implement the individualized treatment plan. And then as I'm working with the child, I'm collecting and analyzing the data to monitor their progress. And then I will provide families, teachers, other support staff, anybody in the child's life with strategies to support their speech and language development. And then ideally, we would like the child to be able to generalize the speech and language skills that they're learning in different settings. So not just being able to do things in my speech therapy session, but taking that and using that at home, using that out in the community, or using that in their school environment. Yeah, go ahead, Teresa.
In terms of ABA therapy, so we're typically more behavior-based. We focus on behaviors that interfere with learning. So we do have some learners that, have self-stimulatory behaviors, have organizational behaviors. Some of those behaviors don't really interfere with learning, so we try not to focus on those as much. We focus on ones that impact learning, daily living, even in terms of like aggressive or self-injurious behaviors we focus on. So we typically will develop behavior intervention plans that are individualized to each of the clients. We focus on functional, social, communicational, and daily living skills. So everything that's needed in terms of daily living, toileting, dressing, eating meals, just even getting through a school day, and how do we communicate our wants and needs throughout that day. We do collect and analyze a lot of data. Our goal is to make sure that we are making meaningful progress. So we're constantly looking at our data and seeing, is this working? Is this not working? Do we need to go back to the drawing board? We have what's called parent education as a component within ABA, where we train parents, caregivers, staff that work with the client on behavior strategies, the best supports, even antecedent strategies. So, what do we need to do to set this learner up for success? And then our goal is to reduce some of those maladaptive behaviors. So, again, the behaviors that are affecting daily living, that affect others in terms of that social component. And then we also work on generalizing those skills across the home, school, and community. So I know for uh, us with as ABA providers, we typically tend to have more hours that we work with a client on a week-to-week basis. So for the client that Caitlin and I share, her name is Rose. We see her in home, we see her in an after-school program, and then sometimes we will see her in the community. So more recently, we, helped in her trick-or-treating process and what that looked like and how she used her AAC device to do that. So ideally, we try to make sure that all the skills are used in all facets of that child's life. You want to go to the next slide? So when we started working with Rose, we had taken over from another ABA provider. Um, Anytime I work with a learner that's AAC based, I always like to defer to the speech therapist on what we're doing and how we're doing it, just because they are the professionals in that scope. Even in terms of the app that we're using, the way in which we're presenting it, the icons that, we might want to add in there to help support her throughout her day. So usually when we have a collaboration session, our collaboration session usually happens on Mondays. And it's an hour. Our BI is present. Sometimes I'm present, depending on the week, and the SLP is present. Caitlin's present on Zoom. Um, and usually we start the session with just kind of a check-in and a collaboration. So we're discussing what it is that has been going on in Rose's day. Is she having a more sensory-based day? So if she's having a more sensory-based day, she might be seeking more movement. So in that case, we're moving around with Caitlin and we're doing more movement-based activities for that speech therapy session. But she is using her AAC to request those things. So she can request big ball, which is a yoga ball she likes to bounce on. She can request to dance. She can request to use a weighted object. So like she has weighted blankets and weighted lap mats. But if we're having a session where she wants to snack more, then we're focusing on foods and her requesting those foods. So it really is, we're checking in, we're touching base. If there's been a lot of behaviors for that day, we kind of reduce demands for that session. So Caitlin knows, okay, it's been kind of a rough day, so we're not going to work too much today. We're going to place a little bit of demands, but we're going to take it slow, knowing that Rose has had a little bit of a challenging day. And this, I mean, I feel like goes for any session that we have with clients. We try to modulate based on where they're at. Then we talk about what we're going to target. So within those sessions, because we're focused on that AAC piece, Caitlin does kind of take the lead and says, let's work on this. Let's focus on that. Let's have her request. Can you guys take her to the food tab so she can let us know what she wants to eat? Or let's ask her a yes, no question and take her to the yes, no prompts. So she usually will guide us through what it is that we're working on. It's also a good opportunity for us to kind of check in and see and ask questions. Like I said, there was a time when, we were noticing her wanting to request using the restroom more. And so I remember we sat with Kaylin and we had a conversation, what icon would be the best to use and what do you think we should do and where should we put it? Should it be on the front page? Should it be within a folder? So all these questions are really important because although we know Rose well and we understand AAC, I do feel like we always want to defer to the speech therapist on some of those things. And then at the end of session, we kind of do a recap. So we'll discuss, what we want to work on next week. If mom has any questions, if the BI has any questions, it's nice to kind of check in and ask and see what the best way to support Rose using the devices. So this is typically what co-treatment therapy session looks like. I will say that uh, I don't know that a lot of it's rare that a lot of providers do work together, but I do feel like we've got a really nice relationship, and it's been awesome to kind of learn from each other and get a really good picture of who this client is and how we can all support them. I think that collaboration piece is huge. It's very much like when you're working with a client, It doesn't matter whether they have autism, cerebral palsy, Down syndrome, just speech and language delays. When you have this many professionals working with the client, it's very important that we're all on the same page, that we're all working towards that same goal. And it's like we're all these chefs in a kitchen working on a very similar recipe. So that's our goal and what co-treatment should look like when you've got both of us in there. On the next slide.
Okay. Sorry. Yes, so playing off of what she said, definitely I've had other clients where ABAs try to be involved, but may not be always on the same page. So it's definitely important when you are collaborating that you guys are definitely on the same page because it'll only benefit the child in the best way. So the challenges of co-treatment, kind of going along with what we were saying about how it's beneficial, kind of what it looks like. Here are some challenges when you're incorporating a co-treatment situation. So first off, role overlap or confusion. If there is not clear boundaries, how I do things versus how her BI does things, or just how the ABA does things in general, may overshadow each other or contradict each other. And it's kind of, you want to make sure you're collaborating. So obviously it makes it difficult to talk with that individual if you guys are not on the same page. Another thing that can be a challenge is the reduced one-to-one focus time. So because I'm involved in her therapy session on Mondays, her BI can't do, specific things that they were wanting to focus on. And they're kind of more so focused on what I'm trying to do in my speech therapy session. So that shared attention with each other, collaborating, may mean less individualized focus from me and from the BI working with the child during those sessions. So there's a little bit of give and take on that aspect. There can also be billing or funding limitations. So many insurance plans or funding source don't reimburse when you're doing a co-treatment situation. So you kind of have to be careful with coordinating that or making sure that parents can pay in that sense. With our specific client, I don't believe that we have issues, but I know that that can be a difficulties sometimes. Another thing can be scheduling challenges. Obviously, it works out with the client that we work with. They happen to have ABA around the same time that I have my speech therapy session. So that works out. And my client is only one time a week. So that works out. And then her BI can be there the other days of the week to do the other days that ABA is scheduled for. But coordinating times between multiple providers and the family can kind of be a logistical difficulty. Obviously, it sometimes can work out in the case of Rose, but certain clients, you just can't always make it work. Another thing that can be challenging is the different therapeutical priorities. So ABA may be focusing on more measurable behaviors, while speech therapy may be prioritizing more of that functional communication, which again, if you're not aligned or those roles are confused or overlapped, it can cause tension if you're not aligned on the priority for the child. And then the last kind of challenge with co-treatment is the potential overstimulation that it can cause, having multiple people in an environment, especially with a child like our client that we share who already has sensory challenges. Having too many individuals in one space can be overstimulating or distracting to the client. And I know that I do think that sometimes when myself or a mom or the BI or Tressa is there, we're all talking to Rose. There was actually a session a few weeks ago. I think, Tressa, you were there. And then your BI was there and mom was there. And I think at some point, which also makes it hard because I'm on telehealth, and so there's always that lag talking with each other. But like you three were talking in the corner, but I was trying to listen. And I was trying to give my input or like, hey, let's do this, or Rose, what do you want to do? And I think that could possibly cause difficulty with her and definitely with other kiddos, especially those who have sensory challenges. Next slide.
Yeah, so on the next slide, we'll talk about the benefits of co-treatment, which again, it could be a little bit challenging to set up, but I do think overall it provides a better service for Rose because her communication and her behaviors kind of fall hand in hand. She's having behaviors because she can't communicate. Nobody's understanding her. So it gets to be a challenge. And so for us to be able to have that support to help her communicate helps reduce a lot of the behavior. So they really go hand in hand. When we talk about the benefits, we look at like collaborative goal alignment. So I know when I had done my report after the fact, I kind of looked at Caitlin's report and her goals, and I was like, okay, perfect, we're right on the same page. But if there was a goal in there that maybe she had that I hadn't thought of, it was also beneficial for me to say, yeah, we can target that goal too. Especially because when you're looking at speech therapy, typically most authorizations are 1 time a week, 1 hour, whereas with ABA, we sometimes see a kid for 20 hours a week. So if we can coordinate and work on that same goal and we're focusing on the same skills, it really does show progress a lot quicker than what you would typically expect. Looking at generalization of skills. So because we're working on the same programs, because we're working on the same skills and teaching Rose how to use her AAC, teaching her how to request things with her AAC, she ends up using those skills a lot in the natural environment, especially since we are seeing her at a day program. We are seeing her out in the community. It helps us kind of make sure that she's not only using that AAC device when she's in speech therapy, but also when she's at the day program, also when she goes to the store with mom, also when she is at church on the weekend. So, generalization of skills is such a big piece. That just means that your learner can do things not just in therapy, but outside of therapy. And it really increases their ability to access the real world. Because if we have a learner who just uses AAC, in the home with the family or in session with the speech therapist, and those skills are not used out in the community, they're not generalized, they're not really learned completely skills, and we really want her to access that real world, to access more people and communicate. We get to share our data and insights. So even when we're having weeks with Rose, especially when we're talking about Sanfilippo kids, the medical stuff is always such a big factor. So we would have a week when Rose was not feeling her best, when she was a little bit more sick, or we were seeing more symptoms. And so we were able to kind of touch base with Kaylin and be like, she's not using her AAC as much this week, but we are noticing a lot more vocalizations, and she's gotten a lot more words that she's throwing out there. So then we can kind of share that data and adjust our sessions, adjust our approach, kind of follow her lead, and then make sure that we're getting all of her needs met in terms of her requests for food, her requests for sensory. Um, Looking at it being a little bit more efficient for scheduling for families. So again, because our sessions overlap, when we think about scheduling, anywhere between 15 to 20 hours of ABA therapy, and then also speech, and then also physical therapy, and then OT, all of those therapies, you end up having a kid who has a full-time job. But when we overlap some of those sessions, again, we get the collaboration piece and it helps with scheduling because you're seeing both of us in one shot and we're focused on different things, but they kind of link together. That communication and behavior piece is hand in hand. When we look at prompting, so when we're talking about AAC users, the prompting method is very different than ABA typical prompting or prompting actual vocal language or sign language. So making sure that we're consistent in prompting as an ABA provider, we rarely receive training on AAC users. You have to go and seek that training out and, you know, learn from other people. So to be able to be in session and touch base with Caitlin and say, hey, are we prompting this correctly? Should we be modeling this more? Is there a way that we can get her to go through folders a little bit differently? It definitely helps reduce her confusion. It helps reduce our staff's confusion and everybody in the family so that we're all on the same page about how to prompt her, how to reinforce her. Especially she's the type of kid that will, ask for crackers 5 times as if we didn't hear. And we're like, we heard you, we know, but dinner's coming. So when she does that, we call it spamming. She'll just kind of push that button over and over again. And we're like, we know you want crackers, dinner's coming. So you can tell she's learned a lot with this AAC process and it's reduced a lot of her frustration. And then when we look at our treatment planning, so we both have our own treatment plans. ABA has their own treatment plan and speech has their own treatment plan. But when we do these joint sessions, we get kind of an interdisciplinary approach where we can have goals that focus on the speech piece to help reduce behaviors. So one of the goals that we have for Rose is to request sensory, because oftentimes when she is upset, frustrated, when she's dysregulated and her arousal levels are all over, what'll happen is she tends to engage in more elopement behaviors, more hitting behaviors. And it's not, again, it's not an aggressive piece. It's not her wanting to punch people. It's just she is dysregulated and she doesn't know what to do with her body. So one of our goals was for her to use her AC device to request sensory, to request some type of input. And so that's something that we work with alongside Caitlin to make sure that we're providing those opportunities, but it's also reducing that behavior piece. So getting those goals to align is also a really big, important part that helps us kind of collaborate, work together, and really help Rose progress in a way that I think has been great to see within the last year. On the next slide, Caitlin's going to go over the benefits for a Sanfilippo kid.
Okay, so first thing, as far as the benefits regarding a child with Sanfilippo, it will promote improved communication interaction. So the speech therapy and the ABA can focus on that AAC device. And if anybody is unfamiliar with what AAC is, it's considered augmentative and alternative communication. So that can include the high-tech communication device that Rose uses, which is basically like an iPad type device that has icons and there's a voice output. So that's what the term speech generating device is right here on the slides. And then there's also, picture communication system. So something that's called PEX, Picture Exchange Communication System, or just a low-tech AAC board is just a picture icon and the kid will tap it and it's just a picture. So speech and ABA being able to focus on those forms of AAC when speech declines is important. Because obviously, as we know with Sanfilippo, those skills will eventually regress. Rose was, I know mom always mentioned how Rose was, verbal at a time, and then she eventually started to decrease. But I know, as Teresa mentioned, she does have these verbal approximations that if you are familiar with her, you understand some of those. So her, myself, mom, and the BI tend to understand some of those verbalizations, but lay people may not understand that. So obviously her speech has declined, and using that AAC can help her with that communication and interaction with others. Another thing that can benefit a child with Sanfilippo is that behavioral or emotional regulation aspect. So ABA-based strategies can help with the management of behavior challenges like the aggression, like the self-injury, like non-compliance, by helping to identify those triggers and teaching a replacement behavior. I believe something that we do with Rose is we clap our hands, I believe is what mom does, or we hold hands, I believe is what she does, which is kind of that replacement behavior. Because, when she's so emotionally dysregulated, she does this like kind of swinging thing with her arms. And so, that replacement behavior was, we hold hands. While speech can focus on teaching the use of AAC to communicate her emotions. So sometimes with Rose, she's, kind of doing those behaviors and we might say, how do you feel right now? And she can use her device to tell me tired or frustrated, whatever. And you can figure out, okay, yeah, that emotion is matching that behavior. So being able to manage that along with the device is beneficial. Another thing is being able to preserve those functional skills. So obviously the focus is often on the adaptation and maintenance rather than the acquisition of new skills, especially when the condition progresses. So, Rose had X amount of skills when she was younger, and then, the disease has progressed. And so, we just want to make sure we can help her keep those skills for right now. The goal is not necessarily to help her learn new things, but to just make sure that those skills are still there. So that's definitely some of the benefits for our Sanfilippo kiddos. On the next slide, I think Teresa is gonna finish it up.
So the next piece is enhancing quality of life. So when we're looking at that Sanfilippo piece and the possible regression of skills, like we want our clients to be able to communicate and have these interactions, communicate emotional discomfort and comfort. So just in a more recent situation that occurred, the BI was at the after school program that Rose was arriving at. As soon as Rose got off the bus, she kind of noticed, she looks upset, she looks frustrated, she looks, she'd been crying. So the BI kind of took her to that emotions tab, like Kaylin was talking about, and she said, "How are you feeling?" And she said, "Ouch, mom, go home." And the BI asked her again, "You're feeling ouch? Are you hurt? Where are you hurt?" And it was a little bit harder for her to let us know where she was hurt, but she did again say ouch and go home. So then luckily the BI was able to contact the mom and have the mom come pick her up early from that program, and she was not feeling her best. But it was a way for her to communicate that she was not feeling well, that she needed to kind of get out of that environment, that she possibly needed some type of medication. So those positive interactions, although for her it was probably miserable and she felt terrible, it was a great interaction because we were able to see she could use that device to communicate her discomfort and that she needed something. When we look at the benefits of family and caregiver support. So I know we're able to coach the family on different strategies. I always let my families know that although we're the professionals in behaviors and Caitlin's a professional in AAC devices and speech and language, that they're still the professional of that kid. So it is very much a collaborative process when we provide that caregiver support, when we check in, when we ask, well, what's worked before? What challenges are you seeing? How can we support, you know? But ideally, if we can train that family, you'll see, especially in Rose's case, mom is very invested in the AAC device and the use. Mom practices it throughout the day, asking Rose how she feels, what she wants to eat, if she's ready to get ready for bed, if she would like to watch a specific show or cartoon while she's eating her dinner. So that family caregiver support is huge because again, you get more buy-in, you get the families using this device throughout the day, and the more that we use it, the more that we model it, the more that Rose is likely to use it, and then it'll prevent some secondary challenges. So again, when we do that therapy together and we work with them together, we can reduce some of that frustration because again, her behaviors typically are her form of communication. She is communicating she's hurt, she's communicating she's upset, she's communicating that she needs to move and dance. So a lot of the times, if we can give that communication tool, we can find out what it is that she wants and be able to get it more functionally. And then we look at giving her more support in that movement and engagement activity. So Rose, and I know a lot of our clients tend to be kids that like to move. They're not often sitting and learning. They want to move around. They want to explore the environment. So for her to be able to request that she wants to dance during speech therapy is a win for us. For her being able to request that she wants a specific song that Kaylin will play for her is a win. And whether she's doing it through the AAC device or sometimes those word approximations, it's always helping prevent some of those behaviors because she knows I'm understood. Everybody knows what I want and they're getting it. So the benefits for children with Sanfilippo are huge, just in terms of us working together and in terms of the use of an AAC device is big because it helps when all those motor skills start to regress. It helps when we start to see a regression in that language piece. She has that AAC device to fall back on.
Actually, before we talk about anything upcoming, I do have a couple of questions. Okay.
Mhm.
I know you guys talked a good bit about that overstimulation piece. You're looking for those unhappiness indicators. Are there any that you've noticed working with Rose over the years that are a little bit more Sanfilippo specific or surprising to you as being an unhappiness indicator, a sign of overstimulation that other providers can look for?
I feel like it's very like idiosyncratic, like it's very independent upon the learner because I know for we did notice like a movement piece, like her not wanting to sit still when she was kind of uncomfortable, her needing to move a lot and almost feeling over energetic. Like we would say, you know, Rose is on a good one today. She's moving a lot. But then there's days when she is almost moving too much, and then we get a lot of the verbal, and it's more of like and it's a lot. It's very loud. And the first time I saw it, I asked mom. I said, "This is different. I haven't seen this before." And then mom said, usually I notice that when she's like this, it's something's going on. Like she's uncomfortable. She's not feeling well. And then mom takes her temperature. Mom goes through all the checks. And then we ask her how she's feeling, and she will tell us. She'll say upset. She'll use sad. She's used sad on her AAC board too. So I feel like it's very specific to the kid. So I think it's also good that like you have good you have professionals that are constantly observing and saying like this is different or what does this mean? And then you have parents who are really good at, reading their child's cues and knowing this is not this is a different cry. This is a different vocalization.
Yeah. One thing that I have heard about is, those changes that happen as our kids get older. So how have those requests from Rose changed as she's gotten older?
Um, I'm trying to think back when I started with her because I started with her when I was an SLPA 3 years ago. Um, and I feel like she's gotten more consistent with things that she really wants before. Like I think she's starting to combine two icons more consistently, I believe. I think I want to say when I first started with her, it was a lot of single requests. And I think I guess that would be kind of what I would say, at least just from knowing her those past few years.
Hmm. I would say we've worked with her for the year. I would say some of the motor stuff, because we look at some of the motor challenges and those regressing. So I know recently we were able to get the key guard for her on an AC device, which is
Yep.
basically a piece of plastic that covers and separates each icon. So that way she can be more accurate when she's pushing icons. Because sometimes she would just use a whole hand and we would
Yep.
get several different messages. So that piece is interesting. Within the year, I have noticed she's although she has Sanfilippo and developmentally she's not at that age that she's at, she still very much is. So I've noticed choices in songs. So she does like, your typical nursery rhyme songs, but then also she started to like like Justin Timberlake. She loves the song from Trolls. And last week the BI started singing that Justin, she was saying baby over and over again. And so the BI was trying to figure out what baby song she wanted. Was it Baby Shark? Was it Baby Beluga? And then jokingly the BI sang the Justin Bieber baby song and she was all about it. So it's been on repeat this week. So I do feel like she still has some of those like teenager, preteen components. The
Mm-hmm.
other one is she had learned to use excuse me. So she has an excuse me icon on her AAC. And if ever, and I know Caitlin's seen it in speech, if we are talking and we're doing that check-in collaboration piece and nobody's paying attention to her, she'll be like, excuse me, excuse me, excuse me.
Yeah.
And she will spam it until we give her that attention. So you still see some of those components of like her having a little bit of sass and her having that personality. So I do, the AAC piece is always interesting because I feel like a lot of families think you won't get that personality piece. You won't get that language piece of, getting to joke around and talk about those things. But like she still very much gets that across. It's very funny.
Yes, I agree with all that.
So you would recommend adding in those elements of an AAC, not just a yes or a no, but like adding in some of those flair to the device.
Yeah. Yes.
Very
She has
specific to
a
the
she has a dance.
child.
Yeah, she likes dancing. So like dance is an icon that she uses a lot of with our BI. And so I do think like it is like Kaylin saying, it's very specific to her. It's very specific to the snacks and foods that she wants and needs, to the music that she wants to listen to and the shows that she wants. So all her favorite shows are on there. So she'll ask for specific shows. But yeah, it is very specific to her.
Is there a change in, an improvement or a regression that you guys have noticed in verbal speech or verbal approximations when you're using AAC, or do they kind of go hand in hand and support each other?
I really think it depends on her day, how
Mhm.
verbal, like if she wants to be like, I don't want to talk, I don't want to use my talker today. I want to use my voice today. She'll try to use a lot more verbal approximations. I think there's other days where she's very much using the device and I'm only hearing maybe like vocalizations to express her like emotions rather than actually trying to request or protest something. There's some phrases that she says is like no mama, or she'll say another one. And obviously we all know what those mean. But there's other days where I'm not hearing that and she might just use the device to request another one or to tell me no.
Oh yeah. Yeah, it is definitely like a day to day, but it's never I feel like a complete regression. It's more so like today's a talking day. Today she wants to sing a lot and she's using a lot of those words and songs to kind of get us to sing that song with her. So she'll say row, row, and then we know, okay, we want to sing row your boat. Okay, let's go, let's sing it. And then there's days when, she may be more dysregulated. She may be more movement based, so we're getting less of that language. So it really is, like I said, it's a lot on us and mom and everybody kind of reading her cues and then following her lead. Like today's a talking day, so we're not going to use the device as much. We still prompt it, we still have it available for her, but you can tell there's some days she's really trying to like vocalize and say those words.
So my last question here, let me make sure I don't have any others. So my last question is, as providers, walking into a case like this with Rose, who has a rare disease, what information about Sanfilippo syndrome did you find most helpful in working with her and, developing these goals and just supporting her quality of life?
Think for me, excuse me, I think for me is realizing that aspect we mentioned earlier where we're almost kind of maintaining and adapting her skills, where I'm not always going to be teaching her something new. Whereas, other kiddos that I work with, who have maybe, maybe they're just only speech and language delayed, or maybe there's something else going on like autism, where they can develop more skills as they're getting older, but as she's getting older, she is going to be regressing. So I guess just realizing that as a provider that I can only do so much to help her learn new things. I mean, she might still learn new things, but eventually it's going to regress, unfortunately. And we just got to help her to have those skills to be able to functionally communicate and help with that quality of life.
Yeah, I think for me, Rose was definitely our first Sanfilippo case and first client that I've ever met with Sanfilippo. So I was very intrigued and wanted to take on the challenge. So I did a bunch of research on it. Muna, Rose's mom, was amazing. She sent over some stuff too. What I found most helpful that she sent over was a one-page profile on Rose. So it was this individualized list of things that Rose enjoys music, Rose enjoys her snacks, Rose enjoys a lot of movement, Rose tries to engage with other people, but sometimes, she kind of windmills her arms and she can hit someone, but she really is trying to engage and socialize with peers. So it was a great, just information on her. Coming in very similar to Caitlin, like realizing that we really needed to break skills down into smaller steps. And then we really needed to follow Rose's lead and focus on the things that she was motivated by to really get her to use that AAC device, to get her to understand. And then the other big piece was training the people around her. So because we see her at a day program or an after school program, the staff at that after school program are really knowledgeable, but again, when it comes to the behavior piece, they needed support and they weren't sure how to support her on the days that she was really dysregulated. So it was a matter of, problem solving and troubleshooting and what works on this day, maybe it doesn't work on this day, but we have this toolbox of great things now at the after school program that even they, when they see her come off the bus and they see her look dysregulated, they see her looking upset, they're able to kind of go through that toolbox and be like, let's use the body sock. Let's get her the weighted lap mat. Let's put her in the office chair so she can spin around for a few minutes. So it's been great to kind of collaborate and like train others around her and how to support her. That's definitely been a big piece is everybody kind of learning how to help support her because it just reduced frustration. Everybody kind of knew where to approach her and how to approach her. And so I think overall it's been a really positive experience.
Those were all the questions that we had that we got through. Um, is there any last imparting thoughts that you guys would like to share?
I think just overall, I know Caitlin and I have kind of said it before, like to each other that we really hope that other providers can do similar what we're doing, can like collaborate with each other and work together and like put your egos aside and say like this is for the benefit of the child. I know that for us, like we are constantly like, I'll touch base with the family. So if that co-collaboration piece is not capable, like Caitlin was saying, because some of the insurance funders won't allow it they'll say you can't double bill, you can't have both therapists in session. At best, I would work to get your programs to at least communicate, whether it's through email or it's through the parent kind of exchanging information. So some of the cases that we work with that we can't overlap, I tell the family what happened this week in speech. Is there anything that she wants you guys to focus on? And sometimes speech therapists will give the families, a handout on signs that they want to work on. And so I can say, perfect, we can incorporate this too. Let me see how we can incorporate this. Let me talk to your BI. So I do think that collaboration piece is key, whether you're doing an overlap in session or you're just getting all of the chefs in the kitchen together for a minute or in an email chat, just so that everybody knows what we're working on and nobody's stepping on each other's toes. And it really is a more cohesive program for your learner.
I agree. I've had other clients where I've simply just had that email back and forth with them, but I've also had clients like you guys and another couple clients that physically come to the clinic I work at, and they want to observe, they want to see um, what we're doing. But I've also had another instance where I had the ABA, adding things on the device without asking me, and it was kind of this weird tension thing. So definitely keeping that, either if you can't directly speak with them, having the parent communicate like, hey, we need to make sure you're collaborating with us, or directly speaking to them definitely is important. It can be challenging, but it's good to do.
Here is our contact information. All general inquiries go to our entire team using the contact at curesanfilippofoundation.org email. If you'd like to reach out directly to me, here's my email address and my cell phone number. Please feel free to reach out anytime. If you would also like to share your story with us, we welcome all Sanfilippo families to become partner families with our foundation. This is a group of families who believe in the mission to find a cure for Sanfilippo syndrome and move the needle forward on research. You also have the option of sharing your story on our website. If you want to learn more about that, please feel free to reach out to us anytime.
Yeah.
Thank you guys so much for this. This is great to just see a team, work so smoothly and collaborate so well to make sure those goals and the quality of life for this child is the most important thing on everyone's mind. So, really appreciate you guys taking the time to talk with us today and share so much with us about Rose and about, the work that you're doing with her. So again, thank you for joining us. And if you're watching the replay, thank you so much for watching. And we hope you have a wonderful day.